Hi, I'm Dr. Sunil Richardson, maxillofacial and a craniofacial surgeon. I practice both out of South India and also out of the Middle East. Haven't been to the Middle East for a while now since this pandemic. But right now I'm at Richardsons in South India in the state of Tamil Nadu. We have this brave boy with us. What we're going to do is underbite correction. He's just turning 12, but because he had cleft, his upper jaw hasn't grown as much as it should have, and therefore he has what is technically called as maxillary hypoplasia. Maxilla refers to the upper jaw, hypoplasia refers to hypo, less, plasia growth, less growth of the upper jaw, or in other layman term we just call it underbite, or a condition wherein the lower jaw is over the upper jaw, right? So we're going to show you how he looks. I'm also going to tell you how, Kadida, that's a bite, you see? That's what we say underbite. His lower jaw is ahead of the upper jaw. Kadima? Right. So what's the plan? We're going to get the upper jaw forwards and a little bit downwards, but mainly forwards, right? And I'm going to show you the appliance he's wearing inside. Why, Torada? Look at that appliance. So that's an appliance that we fabricated here. That's a tooth bone custom made intraoral anterior maxillary distractor. Okay, now this distractor, after it's placed, so I will do a surgery in the upper jaw. We will segmentalize the upper jaw from the nose and then split it inside through the palate. Inside in the palate, and then stretch the upper jaw outwards. This is called as anterior maxillary distraction. This is simply the best way to correct maxillary hypoplasia or underbite, especially for cleft patients, because the speech improves with this. A lot of cleft patients have good speech. Those that we do have excellent speech here, but this guy had his palate done elsewhere. I've done a lip revision for him some months ago. But what I'm trying to say is, with the technique of anterior maxillary distraction, the only thing that can happen is improvement in speech. It doesn't get worsened. Conventional orthognathics for this kind of a patient can affect in the speech adversely. Secondly, this is a technique where you create new bone, no relapse, and therefore it's the best. And lastly and most importantly, they don't have to wait till they're 15 or 16. As I said, he's just turning 12 and we can solve his problem as early as that. So gone are the days when you have to wait till all the bones have to mature. Gone are the days when you have to wear a distractor around the head like a halo. I was on this technique more than 10-15 papers. So we've got a team ready for this. It's not just me that we can do this. We need to have an orthodontist and a dentist who really trained to do patients with anterior maxillary distraction or for anterior maxillary distraction. And the beauty is, these people can then go off to school even. There's no school now, but if there was a school, they could go to school. There's going to be very little pain. Plus they can chew for a while, chew after a while with the appliance inside. So, wanna keep a buyer kada? Right, so he's all ready for surgery. We're planning him this evening to do the distraction. It's probably going to take me about an hour at most. We're going to get the upper jaw, and also I'm going to work a little bit in the nasal base, as it gives me opportunity to open that part of his skeleton and that part of the muscle. சரி, நல்லா முன்னுக்கு வந்துரும். அப்புறம் நல்லாவே உனக்கு கடிச்சு சாப்பிட முடியும். என்ன சொல்லிருக்காங்க டாடி? என்ன சொன்னாங்கண்ணா? சர்ஜரியில் என்ன வரும் உனக்கு? அவ்வளோ ஒன்றும் சொல்லலையா? Okay, I'm trying to ask him if his father has told him anything about the surgery, and his father hasn't told him anything. Anyway, so neither have we. We just told him it's going to hurt him a little bit. But he's a brilliant guy. You in the class la padikira? Yeah. He's in standard 7th grade. Okay, right. Injection la potachila? Nina potirukangala? Eppo potanga idu? Nethu potangala. Okay. Cherida. Thank you.